Hi from Philly, I'm Dr. Rachel Tate representing Team PsA and today's Best of PsA for Monday, November 14th, 2022. So our Best of today is really a couple things, but we're going to start with a clinical pearl from Dr. Jason Kolfenbach, whose name I almost always mispronounce, so I hope I got that one right for him. And it's discussing the pattern of uveitis as it may be different than AS versus PsA or an inflammatory bowel disease. Now this was from his Secrets and Pearls lecture earlier this week, but I wanted to bring this up because it's very important clinically. So uveitis and AS is what we traditionally think of in terms of acute in onset, anterior, unilateral, potentially recurrent, and often occurring in males. But what you don't know is that in psoriatic arthritis, we traditionally think of uveitis as being female predominant, bilateral, chronic, slowly progressive. Now obviously if a patient is HLA-B27 positive, their uveitis, regardless of their underlying disease state, may actually adopt more of that classic acute anterior uveitis picture. So I want to make sure you're aware of that. But we are challenging definitions in spondyloarthritis and psoriatic disease. So there's going to be a shift. I predict that there's going to be a little bit of a shift in how we discuss uveitis with patients and what we're looking for. We actually already discussed this with Team PsA yesterday in that single center study that was done out of Spain with abstract 1159. That one, just a quick recap, 5% of psoriatic arthritis patients, majority of whom were women, were also HLA-B27 positive and had that more classic AAU presentation with their uveitis. Now, my second best of for today is abstract 1493 by Dr. Phil Mees et al. This abstract is from Core Evitas. It's patients who are psoriatic arthritis. There are about 300 patients included in this particular study. And they were looking at evaluating the responses between early and late onset of DMARD initiation in psoriatic arthritis patients. Among early initiators, over 80% of these patients started a DMARD therapy in the same or subsequent year that their PsA was diagnosed. Among those late initiators, nearly 50% were initiated on therapy within 2 to 7 years after their initial psoriatic arthritis diagnosis. What they ultimately found is actually both reassuring and interesting. So both of our early and late initiators experienced improvements across all disease state measures, including patient-reported outcomes, up to 6 months after the initiation of their DMARD, which is something we've come to expect. However, the findings also indicated that there was a better response, including potential for MDA, that was achieved more likely in patients initiating DMARD therapy within 1 year of their psoriatic diagnosis versus delaying treatment initiation. So I encourage you to continue to talk to your patients, to do everything that you're doing in clinical practice, to educate your colleagues, to advocate for those patients, and of course, as always, to keep learning so that we can better understand disease. What I also want to remind you is that tomorrow at 7 p.m. Eastern, we are having our Best of the Team PsA for all of ACR 2022. Catch that on roomnow.com. As always, log into roomnow.com for all of the latest and greatest coming from Philadelphia. Please follow me at UpToTate on Twitter. And of course, signing off as I'm catching a flight home from Philly. Make sure you watch for us next year. We'll see you soon, ACR.